We had a wonderful presentation. It wasn't this year, but Dr. Goldstein, I believe from UCLA, came and talked to my committee about diabetes, but also pre-diabetes. Those who are in that space right before you are requiring medications. The pre-diabetes, where you still can do lifestyle modifications or weight loss before you're really requiring pharmaceutical or other types of interventions, are appropriate ways for us to be able to treat this. But one of the things Dr. Goldstein really talked about was how there's an incentive for us as a state to be getting ahead of this, to be getting upstream of diabetes, to be working in the pre-diabetes space, to be screening people at a much earlier age. And so that's the area I really try to work within. How do we help to make sure we can have preventative screenings? How do we make sure that we have access for people in our community? How do we make sure that we can do hemoglobin A1C screenings that we do within all of our health fairs within the Valley? And how do you make sure that they have a place to be able to follow up and to make sure that they're getting education and nutrition information? But I'll add my bias if I can, because my father-in-law has diabetes. He actually ended up getting diabetes from going off to Vietnam. He did 4 tours while he was in Vietnam and got exposed to so much Agent Orange, his pancreas shut down and he developed diabetes late in his life. But because of his diabetes, he's on a continuous glucose monitor. And I think there's a real advantage to those CGMs as they better allow us to dial in someone's treatment. It allows us to gain more information rather than to rely on finger sticks and people taking notes.
Right.
This is a way for us to make sure we are using technology to provide the best outcomes we could. And so while I focus on prevention and trying to
Right.
not have people develop diabetes, I do think we as a state need to look towards CGM as part of the solution for us to make sure we are using all the tools in our tool chest.